Welcome back to Health Matters. In addition to physicals, we all need to get regular tests to check our potentially life-threatening diseases and conditions. Here to talk about these exams is Dr. Bill Light, an internist with Baptist Medical Group. Welcome, Bill.
Thanks, Mark.
Now, Bill is a dear, dear friend. He and I trained at Baptist Central many a night. The only thing that stood between disease and life and death was me and Bill Light.
We were it.
We were it.
The final line of defense.
All right, Bill, you're an established, well-known internist here in Memphis, and a lot of folks come to see you. We've already had Dr. Pamakela on here about annual physicals. Well, what about patients that get an annual physical, but they also have chronic illnesses like diabetes and hypertension and heart disease? Some people, I know in my practice, get the idea all they got to do is come in once a year. But how careful do we need to follow these diseases?
That's really interesting because it's very variable. You know, I have some diabetics whose blood sugar runs great, and they can send me their blood sugars by my chart, and they're always in control. And some of those people maybe could come in once a year.
Now, let me stop you right there. My chart. Explain to the audience what that is.
Well, my chart is an electronic portal through your electronic medical records. So if you're
through the Baptist system.
Through the Baptist system, Epic. And if you're a patient of one of ours, you can sign up for that, and you can have conversations with your physician for non-urgent things that outside of the office, like you can send in your blood sugars once a week. We can monitor that. We're even looking at syncing, where your blood glucose monitor and your scale might link into your medical record, and someone in our office can monitor that without you having to stop and take a fax to send stuff in. It seems to work really well. So through my chart, you can keep close communications with your patients, and some of them may only need to come in once a year, but most of my diabetics, if their blood sugars run high at times, it's really an advantage to come in at least 3 to 4 times a year. Most insurance companies will cover an A1C 4 times a year, and we like to do that for most of ours.
Explain to us exactly what a hemoglobin A1C is.
So it's a kind of a complicated test when you think about it. The A1C, it gives you an average of your blood sugar the past 60 to 90 days by measuring the number of glucose molecules inside your red blood cells. So as your blood sugar goes up, more glucose goes into the red blood cells, and since blood cells last about 60 to 90 days, you measure that, you can tell you've had a lot of high episodes of blood sugar. There'll be more glucose molecules attached to your hemoglobin, and they can measure that with this test. It's actually very simply done in the office, but it gives us a measure of your average blood sugar. So you can take your blood sugar every morning, it may be normal, but after that Dunkin' Donuts trip, it may spike high, but by the next morning back down. So the A1C can give us an average of your blood sugar and give you an idea of how you're doing on average. Still not a perfect test, because you can have ups and downs, and the average may look better than your sugar, but that's why you have to come in more than just showing up once or every a year or 2 years. It just isn't going to be enough for most diabetics. But many people I have, once they're diagnosed with diabetes, they exercise, they watch their diet, and they check their sugars, and everything's going good. And I may say, come back in 6 months or even a year, but most of them I'd like to see about 4 times a year.
Now, the other chronic illness that we see a whole lot of is hypertension. And we both have had the patient that comes in with high blood pressure. We give them a prescription, they come back, their blood pressure is good, and they assume they don't ever have to take the medicine again.
Right.
They're cured.
Right.
But we know that's not so. So what do you recommend to the patients about coming back in and getting their blood pressure checked and following up with you?
Well, the first thing is never run out of your blood pressure medication. In fact, we'll call in or get you samples or whatever we need to keep you on your medication until you do get back in. Running out of blood pressure medicines is probably the most dangerous thing I see in my hypertension patients. They'll be doing great on 3 blood pressure medicines because they have very high blood pressure, and then run out of medication, and it's just too much trouble to call, or they're embarrassed because they hadn't been in and they've missed an appointment, and they come back in, their blood pressure's 200. I mean, I really worry that someone will have a stroke or something terrible happen because they run out of their medication. So we have a rule that will always get you your medication until you can get back in. Blood pressure follow-ups depends on how you're doing. If you're taking 1 blood pressure medicine and you're in good control, you know, again, maybe 6 months, maybe a year for a young, healthy person with blood pressure medicine. But most of my people that are taking several medications, I'd like to see them about 4 times a year, every 3 months. Those things work out pretty well, because we like to keep tracks of things like their kidney function and their potassium and other things that can go wrong with their blood pressure, in addition to the number of the blood pressure that can go off and really cause some serious problems. So the more they come in, the better.
What about the program that Baptist has about high blood pressure?
Well, we call it Measure Up, Pressure Down. It's a national study or program sponsored by the American Medical Group Association across the whole country. We're trying to set standards for blood pressure for doctors all across the country. I'm a big believer in standardization. I'd like a patient that comes in to see me or you or a doctor in Alaska or another doctor in Miami to have a similar kind of experience. If we use similar medications, then we should have similar outcomes. I think outliers, that one doctor out there that's doing something different than everybody else, it's hard to get good medical care if everybody's doing something different. This is trying to standardize the treatment of high blood pressure across the whole country because we know certain things lead to better outcomes. Maybe not on one particular case, but over a whole spectrum. I always use the example when I talked about standardization of a patient was struck by lightning, and he was initially bald, but his hair grew back. So a doctor out in Oklahoma set up this machine to give you electrical shocks to grow your hair back. We know that doesn't work. That was just an anecdotal or an incidental finding. It really wasn't caused by the electrical shock as far as we can tell. So electrical shocks to grow your hair back isn't going to work just because it did that one time. Well, you use a certain medication and you get a certain outcome, that may not be always the standard case. So we'd like to try and standardize blood pressure across the entire country, and so a similar outcome to a similar treatment. I think we can really reduce the number of heart attack, strokes, and keep people healthier.
And that's what this program is about.
And this program is trying to standardize the care across the whole country.
Now, in the last minute or so, what are a couple other screening tests as part of the physical that you recommend?
Well, it depends on your history and your family history particularly. I'm really focused on the effects of, like, I've had a patient, his father had a heart attack at 50. His brother had a heart attack at age 50. He's 49. I think just to take his blood pressure and pat him on the head and say everything's going to be fine is probably the wrong approach. So I get pretty aggressive with either a stress test or this new test called a calcium cardiac score, where you measure the amount of calcium deposits in your coronary arteries. It's a simple test, unfortunately not covered by insurance, but it's not very expensive, and it can give you a measure of your risk for heart disease. Well, we need to be more aggressive in people with risk factors. So if you're a diabetic and you have high blood pressure and your father's had a heart attack, we're going to be more aggressive with tests like stress tests and calcium scores and other markers than just the routine. But if you're a healthy 35-year-old marathon runner and both your grandparents lived to be 110, you probably don't need to have a stress test every year. So it really depends on your risk factors. So that's why you need to see your internist. You need to get a good history, good family history, and make a decision of what your risks are going to be going forward.
And Bill, don't you think that people ought to develop a relationship with their primary care doctor so you get to know them as a person as well as a patient?
I think so. The person, I think you mentioned earlier about who goes to the minor medical clinic every time something comes up and doesn't really get established with a primary care internist. Well, the blood pressure may be up one time, down the next, but it may be more up than down, but they're not getting treatment. They're not making any decisions on the overall, their risk factors, their family history. Those things are important, but they take more time, and it takes time to get to know somebody on that one-on-one basis to make important decisions in their health care going forward.
Well, thank you so much for being here, friend.
It's good to see you.
Bill Light, my dear friend.
It was us against the world.
It was just you and me,
the world
son.
is still standing.
Now, he does not grow hair at his office with that electrical thing he mentioned, so don't go looking at. But you want to get a good physical, you go see Bill Light. Coming up on Health Matters, you're probably already taking care of the vaccines your kids needed to get before starting school. But your work is not done. It never really is. Stay tuned to find out what health needs your kids will have this fall.